My name's Nurse Wren. I'm going to be taking care of you today. I'm going to wash my hands and provide privacy, do a quick safety survey. Can you give me your full name and date of birth, please?
Amy Antor, 9172.
Okay. And I've already gathered my equipment. And I'm going to be doing a head-to-toe assessment of you today. Is that all right? Okay. All right. So, 47-year-old Caucasian female. She's alert. Can you tell me where you are?
In my house.
All right. And can you tell me what day it is?
Wednesday.
What year?
2020.
Okay. So she is alert and oriented ×3. The third orienter was established earlier when she stated her name. All right. So patient is not showing any signs of distress. So cardiac, she's not pale, diaphoretic, not clutching her chest. Respiratory, she's not wheezing, coughing, no labored breathing. Pain, she is not wincing or guarding painful areas. And mood, she is not anxious or restless. So patient's mood, she is comfortable and cooperative with the examiner. She is not labile flat, or she's not angry, crying, euphoric. And posture, she is comfortable. She is not slouching or in a tripod position. And patient maintains comfortable eye contact and has an appropriate facial expression for the situation. And her clothes are appropriate fit and appropriate for the situation. They're buttoned correctly and she's clean. There's no body or breath odors. And patient's speech is clear and distinct, and word choice is effortless and appropriate for the situation. Okay. So now we're going to move on to the vital signs. So normally here I would take her temperature, and the normal range for this is 96.4 to 99.1. And then I would take her radial pulse, which is right here, and her respirations. The normal ranges for this are 60 to 100 beats per minute and 12 to 20 respirations per minute. And then I would take the blood pressure, which the normal for this is up to 120/80, and then pain assessment. So can you tell me 0 being no pain and 10 being the worst pain of all? Can you rate your pain?
2.
Okay. All right. And so now we're going to move on to inspecting and palpating the skull. So her skull is smooth, round, and appropriate size for the rest of the body. The skin is warm, dry. There are no rashes, lesions, edema. It's clean. Her hair is blonde, thick, and evenly distributed. It's clean. There are no parasites. And okay, so moving on to her eyes. Her eyes are symmetrical. There's an appropriate distance between them. Her eyebrows and eyelashes are evenly distributed. And her sclera is white. Her irises are blue with well-defined margins. And there's no drainage. And then I'm just going to assess her pupils here. If you'll look right at my nose. All right. And then if you'll follow this with your eyes. All right. And the pupils were even or equal, round, and reactive to light and accommodation. And her extraocular muscles were intact, and there's no nystagmus. So cranial nerve 3, 4, and 6 are intact. And then could you lift your eyebrows for me? Could you smile, frown, show your teeth, and puff up your cheeks? All right, so cranial nerve 7, the facial nerve, is intact. All right, so moving on to the ears. So her ears are symmetrical. They're aligned with the outer canthus of her eye. Just going to palpate the pinna, tragus, and the mastoid process. The ears are, the skin on the ears is clean, warm, and dry. There's no redness or drainage. So moving on to the nose. The nose is symmetrical. There's no deformity. Could you occlude one nostril and breathe for me? And then the other? And there's full patency of both nostrils. And then now onto the mouth. The lips are pink, moist. There's no lesions, rashes, or edema. And then would you mind showing me your teeth? And then open your mouth. All right. Normally I would have a tongue blade here to help assess with this, but the teeth are white. There are no missing or loose or decaying teeth. And then would you mind showing me your gums? Right? Her gums are pink and moist. There's no redness, no bleeding, no edema. And then would you mind sticking out your tongue for me? All right. Cranial nerve 12, the hypoglossal nerve, is intact as evidenced by a midline thrust of her tongue. And normally here I'd have a tongue blade to help assess for the back of her throat and her tonsils, but would you mind opening your mouth the best we can? The pharynx is pink. There's no exudate, no lesions, and the tonsils are 2+ with no exudate. And normally I would use my tongue blade and to depress her tongue and ask her to say ah, and then also elicit a gag reflex by inserting it further into the pharynx. This would show that cranial nerves 9 and 10 are intact. All right. So moving on to the neck. So her neck is symmetrical, skin color is congruent with the rest of the body. The skin is warm, dry, it is clean, there's no edema or lesions or rashes, and her trachea is midline, right? And then I would assess the tonsils, the tonsillar lymph nodes, right? And the occipital, which are at the base of her neck, base of her skull. And then the anterior cervical and the posterior cervical. So there's no tonsillar adenopathy. And next, I'd auscultate her carotid pulse. I don't actually have a bell on this, but I'm just going to pretend. All right. So can you take in a breath and hold it for me, please? And let it go. And then one more time. And you let it go. Okay. And there are no bruits noted. All right. And then would you turn your head against my hand? Against my hand. And then the other one. And then would you lift up your shoulders? All right, so there's equal strength bilaterally here, and this shows that cranial nerve 11, the spinal accessory nerve, is intact. All right, so I'm going to ask you, do you want to turn this way and take off your flannel for me? Oh, other way, like legs that way. All right, and then I'm just going to inspect her posterior thorax. Okay. And so the skin is warm and dry. Its color is congruent with the rest of the body. It's clean, there are no rashes, no edema or swelling. Her respiratory rate is a regular rate and rhythm and effort. Right, and now I'm gonna auscultate at sites 3, 4, 5, 8, and 9. If you want to turn a little more this way so they can see. No, like your back towards the camera. Sorry.
Like that?
Yeah. And then every time you feel my the diaphragm of my stethoscope as your breath, can you take in a deep, full breath through your mouth? I'm gonna lift up down here. All right. So there are vesicular sounds here, and they're the same on both sides. And normally here I would also assess her buttocks, but we're not going to do that for the purpose of this. But I would do that by just pulling her pants down like no more than need be to inspect the buttocks to make sure that there are no lesions, rashes, or edema down there. All right, and then you can turn back towards the camera. And if we had the right table for this, I would put her back at a 45-degree angle here to assess for JVD. And I would measure it by putting my ruler at the sternal notch and like putting it like this to her chin. And I would use a pencil or something to align it with the JVD to make sure that it's not more than 3 inches. And then, all right, and then I'm going to inspect her anterior thorax. So the thorax is symmetrical. Would you mind putting your arm over your head like this? Okay, so there's a 1:2 ratio of her side to her chest, so there's no barrel chest. Put it back down. And the skin is warm, dry, it is clean, there's no edema or rashes or lesions. The respiratory rate is regular rate and rhythm and effort. Okay, and then here I'm gonna palpate for heaves, lifts, and thrills. So I'm gonna like right here. If you want to move over your so here. Sorry, I'm down in here. Right under, right apical. All right. So there are no heaves, lifts, or thrills, and now I'm gonna auscultate the apical pulse. So I'm just gonna go under here. All right. Regular rate and rhythm for the apical pulse, and it was 78 beats per minute. And no abnormal heart sounds. All right, and then, all right, so I'm gonna have you lay on your back now, please. Have your feet up like your legs just like that, and your hands next on your sides like that. Charlie, it's not a game. All right. So her abdomen is flat, and I'm gonna pull it up to assess it. So the symmetrical, the skin color is congruent with the rest of the body. And then could you lift just a little bit off of the couch, like right here? All right. And you can go back down. So there's not a hernia, there's no pulsations. So now I'm gonna start off by auscultating the 4 quadrants. All right. The bowel sounds are normal, active. All right, and then I'm going to lightly palpate in the subquadrants. All right. So the abdomen is soft, the skin is warm and dry. There's no rigidity or pain, no masses. All right. And you can sit up. All right. And then, so could you hold up your arms to me? Yep. The skin on her warm arms is color is congruent with the rest of the body. It is warm and dry. There are no lesions, rashes, no edema, and there's full skin turgor. There's no tenting, and the nails are pink and smooth with instant capillary refill. Feel your radial pulses. So the pulses are 2+ and with a regular rate and rhythm bilaterally. Right. And then will you grab onto my fingers and grip them as hard as you can? All right, and you can let go. So there is her grip strength is equal bilaterally. All right, and then going down to the legs. I'll just pull them up a little bit. So the skin color is congruent with the rest of the body. It is warm and dry, and there's no, it's clean. There are no rashes, edema, or lesions, no viscosities. I'm going to take your shots off. Here. Here. Probably should have told you to do that before. All right, and then there's no edema at the pretibial. Okay. And the toenails are pink and smooth with a instant capillary refill. And the dorsalis pedis is 2+ bilaterally with the regular rate and rhythm. And the posterior tibia is 2+ bilaterally with a regular rate and rhythm. And all right, can you press your feet down like you're pressing gas pedal and then pull up on them? So the dorsal and plantar flexion is equal bilaterally and equal strength bilaterally. Yeah. All right. So put this down. Put back down. All right. So thank you so much. I'm gonna wash my hands, remove privacy, and exit the room. All right.